Hi and welcome back. Thanks for joining me again. Today I'm going to discuss the new health assessment that's going to be commencing as of the 1st of July 2025, and that is the Menopause and Perimenopause health assessment. So this one's flown under the radar a little bit, and it only really sort of became apparent to us in the last couple of weeks, and more information has only really just started to come out in the last few days about the item number and the associated rebate amount. So I thought I'd do a quick little impromptu video just to discuss it, because there's been a little bit of conversation about whether or not this is going to be something that nurses can be involved in, or whether this is just going to be a GP-led only health assessment. So I have some views on that, and I'm going to share them with you because I think that absolutely the nurse can be involved in this, and I'm going to discuss how. So first of all, let's outline what the health assessment is going to be. So you can find this information on the MBS website. I've got a printout here. You can just go out and check for that online and print yourself off. And as you can see, I've done that and gone through it myself. So basically, this is going to be a new item number for GPs to be able to perform a health assessment for anybody that is going through early onset of menopause. So I'm going to read it straight from the thing. So anybody experiencing premature ovarian insufficiency, early menopause, perimenopause, and menopause. Now, there's no age range on this assessment. So this could be any age. If someone's going through early menopause in their 30s, we can do it. We can do it someone going through menopause in their 50s and 60s. So I think that's fabulous that we have no restriction on that one. It is going to be billable annually as well. So we can do the assessment again and again while they're going through these particular health concerns. The other limitation, I suppose, the only limitation on it really, is that it must be a minimum of 20 minutes, which I'm sure we could absolutely fulfill that one. And yes, the nurse can assist. So how is this going to happen? How is this going to look? I'm going to tell you in a second. And I guess this will really depend on you as the nurse, what your level of knowledge is. And I think working in cooperation with your GPs, have a conversation with them and let's plan this out. How am I going to be able to assist you? And what is this going to look like in your practice? And I know I work in an all-female GP practice. I have 4 lady doctors. And so for us, we always focus a lot on women's health anyway. So there are some courses that you can do. I know Jean Hales does free workshops and webinars and things like that for you to do in all kind of different topics around menopause and perimenopause. So absolutely go and check those out. Family planning do as well. I do think that they charge a couple $100 maybe, but I think it's quite an intensive, longer course than what you would do through Jean Hales. So doing some of those workshops might be, and webinars and training might be really beneficial for you if this is the kind of thing that you're interested in, and if it's going to work well within your practice with your GPs. Incidentally, the item number for this is going to be $695. The rebate amount is $101.90, so just a shave under $102. When we put that in context with other item numbers, we're probably coming under a bit under a 44. So I guess keeping in mind that with your timing of the appointment. So for a 44, you don't want to sort of be going too much longer over like a 45 minutes. So if you can be keeping the assessment down into that time frame, then that will probably work in well financially. So how are we going to be able to support our GPs and to support our women patients to help with this health assessment. So obviously, when you go through the descriptor, it does tell you the kinds of things that need to be included as a bare minimum. And so that is obviously basic physical examinations, including blood pressure and review of height and weight. And I would include waist measurement in that too. And also we can be involved with doing some information collection. So we can be looking at what symptoms are they starting to experience, or have they been experiencing? When was the onset of that, and how long has it been happening for? What kind of impact is this having on the woman's life? And that's from a holistic perspective, not just the physical signs and symptoms, but mentally, psychologically, socially, with their relationships, work, all of that sort of stuff. So that holistic viewpoint from that woman, how these symptoms are affecting her, what support has she got or not got with experiencing these symptoms as well. We can be looking at their screening status, or where are they up to with their cervical screening, mammograms if they've started having those yet, are they eligible to be doing bowel screening and all of those kinds of things. Definitely we pick and making sure that we have our good thorough family history, especially from that maternal side. So did mum or grandma have any gynecological issues that may be related? Did they go through early menopause themselves? All of those sorts of things. We can certainly be gathering that kind of data. And have they been doing any kind of current treatment for any of their symptoms? What have they been trying so far? What has worked or not worked? Over-the-counter stuff, complementary health, so supplements, vitamins, herbal medicines, those sorts of things. You know, we're kind of willing to try anything sometimes. So, you know, and there's a lot of, I think as women, we tend to, you know, perhaps ask with our other friends or family members who might also be going through these kinds of things. What are you doing for your hot flushes, and what are you doing for your mood swings? And so there's a possibility that they've been trying some different things already, and they will already be able to give you some feedback about how they feel that those things have been working or not working. I think that's a really good start for the GP if you were to gather that kind of information, and then they follow on and then start looking at any other investigations that might need to get done, any referrals, or a discussion about management options, whether that's pharmacological and non-pharmacological, and then talking about all the risks and benefits, etc. So I think we can absolutely share the load with doing some of these health assessments, just like we do with all of the other health assessments that we help our GPs perform as well. And then we can also be involved with follow-up on those things too. You don't know you know, there could be some eligibility for them to have a chronic condition management plan. So then you can absolutely be involved with getting that up and running for them, and then involved in the follow-up and the management of their menopause as well. So I think that this is a great opportunity for us to be really enhancing our things that we do for women in our practice, and the nurses can absolutely be involved in this. I don't know that you know, this should just be a GP only thing, especially with all of the conversations at the moment about dropping nurses' roles in chronic condition management because it's not financially viable, etc., which I call BS on, but that's the conversations that are out there in GP land at this point. So one of the strategies was to get the nurses included in doing more health assessments. I've done my recent video on health assessments and having my viewpoint discussed in that video. So why not involve us in assisting with the menopause and perimenopause health assessments as well? Okay, well, it was a short and sweet one for this one, just a quick update. So yes, as usual, if you like my content, please subscribe. If you like the video, then hit a like and share. And of course, I'm always welcome to your feedback and comments below. Thanks so much for listening once again, and I will catch you next time. Bye for now.